Hi, good afternoon, everyone. This is Puneet Sahota. I'm the research director at the National Indian Child Welfare Association and also a practicing psychiatrist, and that's some of what I'll be talking about today. And joining me is my colleague at NICWA, Adam. I'll let him introduce himself.
Good afternoon, everyone. This is Adam Vicente, a community development specialist with the National Indian Child Welfare Association. Thank you all for joining us today and excited for the discussion and today's content. So thank you so much.
Okay, well, I just want to say welcome to everyone. I know we may have some NICWA members on the call, so we welcome you, and welcome and thank you also to our Tribal Systems of Care grantees who are joining us. Today's topic is how to prevent staff burnout and turnover, and so that's what we'll be talking about. And the webinar is hosted today by the National Indian Child Welfare Association. We're a partner in the National TA Network for Children's Behavioral Health, which is operated by and coordinated through the University of Maryland. So I thought I would first start just by defining what burnout is and how it is different from mental health conditions we might hear about, like anxiety or depression. So burnout can impact professionals in any field who work with other people, and it's especially common in the helping professions, like in child welfare, mental health, law, human services, teaching, counseling, many different fields that involve working with people. Burnout can lead to emotional exhaustion as well as depersonalization, which is where a person doesn't quite feel integrated with themselves. So depersonalization can also feel like kind of being outside of one's body or not really being present at work or at home. Burnout can also lead to a decreased sense of personal accomplishment and can result in people feeling just disengaged from their work and not really feeling connected to or satisfied by their work. There's been some research on burnout in just trying to define what are the core features and what's different about burnout compared to other kinds of mental health issues. And emotional exhaustion is the most common feature that one study found, which looked at several studies grouped together, and it found that around 40% of mental health providers experience emotional exhaustion. And that just means a feeling of being emotionally tired, feeling depleted and kind of drained emotionally by work. So around 40% of mental health providers do feel that. Mental health providers are especially vulnerable to burnout because of some of the unique parts of our work. So therapeutic relationships for mental health providers tend to be especially demanding. People open up to us about things that they may not talk with anyone else about. And sometimes just carrying those secrets and bearing witness to other people's trauma can be a very significant load to carry for a mental health provider. We can also be exposed in a secondary way to clients' own traumas. And when that happens, mental health providers can sometimes get triggered either based upon their own life traumas in their family, or they can just, in a secondary way, feel clients' traumas very deeply. Another part of our work is that we may lose our clients to suicide or violence. And I can speak from, direct experience that losing a client to suicide is devastating for a mental health provider or other human service provider. It can leave you questioning if you had, anything else you could have done differently. It can, especially when first getting the news, it can leave a mental health provider feeling shocked and numb, confused, and lost, and really questioning their own competence and their role in the work. And I can say that when losing a client to suicide, one of the most helpful things I found was being able to process that loss and talk about my experiences working with that client with other peers, so other mental health providers, both on that client's team, but also just people who are my own colleagues. And so I'll talk a little bit later about steps that organizations can take to help prevent burnout in their own employees. And one of those is making space for peer-to-peer mentoring and support among providers themselves. So I can definitely say that, after losing a client, it's really helpful to be able to take that time and to have the support within the organization to process and to talk through that kind of a loss. So the impacts of burnout can be throughout different types of relationships. Burnout can definitely impact a mental health provider's relationships with their own clients. And so when a mental health provider has, for example, lost a client to suicide or to another kind of violence, they might feel afraid to get invested in their work. They might hesitate to connect with clients. And when I say connect, I mean emotionally connect. They might, in the case, of recently having lost a client, they might be worried that that could happen again, and that might change how they interact with their clients. Some people notice that when they're starting to feel burnout, that the level of empathy they would usually have starts to feel different. It doesn't feel like they're as able to marshal their empathy that they usually would. It's like that reserve is not there. So that feeling of emotional exhaustion I was mentioning, the converse to that, when a mental health provider is doing well, is not burned out, is that they have what we might call an emotional reserve. So they have, additional emotional energy that they feel they can devote and give to others. And after all, that's what brings most of us into the helping professions, is that desire to give to others and to provide them support, from the heart. And so when a provider feels like they don't have that reserve, that can impact their attitude toward themselves as well. It can impact their sense of self-esteem and self-efficacy in their job. And so they can start to feel less effective. So for sure, burnout can impact the attitudes that we might have toward our clients, our relationships with our clients, and then in turn, the quality of care that we provide. Another interesting thing that I found in the research on burnout is that professional boundaries can start to get blurry when people are burned out. And so when one sign that people may notice in themselves or their colleagues is when someone starts to, disclose much more personally than they might have in the past, or starts to, cross professional boundaries in other ways. And of course, I think it's important to note that this is culturally variable. And so, there are environments and communities where colleagues, friends, and family all overlap. And so there may be, discussion in the workplace of personal needs and issues. And so that doesn't always mean there's a problem. But I did find in the research that one of the signs of burnout can be when professional boundaries become blurry. Another aspect of the impact of burnout is relationships with colleagues. And so I was trying to say earlier that one sign of burnout can be if a mental health provider feels they need to distance themselves from their clients and just doesn't feel like they have that emotional reserve, to give some of the emotional energy to the client interaction. The same is true with colleagues. And so when a professional is feeling burned out, they may be less emotionally connected to their colleagues. They may become more irritable in the workplace, less collegial in general. And so, for sure the impact of burnout is wide-ranging. It doesn't just impact the one provider who's struggling with it, but also the colleagues they have, the whole workplace environment, as well as their relationships with clients. And I've mentioned this next one a little bit already, that burnout can affect a provider's individual sense of satisfaction in their work that can impact how they feel about their work and about their role in an organization. And a broader impact of burnout is staff turnover. And so one of the reasons, that at NICWA that we wanted to share some information about burnout was to help communities think through, is this one possible issue they can look at as a way to prevent staff turnover. So burnout can definitely impact that as well. So in the research, there were some factors that have been found to be like a risk factor for burnout that can, potentially contribute to it. One of the factors was the size of caseload, and so feeling overworked or overwhelmed can be, that just makes kind of common sense, right? That could lead to burnout if people feel like they have more work than they can manage. The second one I found really interesting. So regardless of what job title somebody has, if they feel like they have a sense of autonomy, that they can decide, for example, how they structure their day, or they can decide, for example, some aspect of how they are going to reach out to their clients, or they feel comfortable enough to speak up for themselves and say, this is what I need. All of that relates to a sense of autonomy and agency. And those are not just factors related to the individual provider or the individual employee, but also things that supervisors can really look at. So one way to help to prevent burnout in your staff is to ensure they have, a sense of autonomy, a sense of ownership, that there is, some part of the work which they feel they can lead effectively and that they're personally invested in. It's that combination of feeling investment and then being able to, carry out vision that a person has in their work that really helps to keep people satisfied at work and helps to prevent burnout. Another factor that's related is role conflict versus role clarity. And that just means for an individual provider having a clear sense of what their role is within their organization or their clinic versus having confusion. So if there is more than one employee, for example, who claim the same area of work, sometimes that can lead to conflict or struggle. But at the same time, if someone is not clear on what their role is, that can also lead to burnout. And so certainly there might be more than one provider with a similar role, but just making sure that there's clarity, whether it's through job descriptions that are regularly reviewed, staff meeting discussions where the group gets together to foster a sense of teamwork. But just making sure that those roles are clear is really important in preventing burnout. And then I kind of alluded to this last one, or the second to last one before, which is that support from colleagues is crucial. It can feel isolating sometimes to be in human services work, especially when we spend our day meeting individually with our clients for many hours or meeting individually with families. We need that time to debrief those interactions and those cases with our colleagues. And so having that peer support is very important and is a protective factor helping to prevent burnout. That's also true of clinical supervision. So the studies have shown that mental health providers who have access to clinical supervision have less burnout. And what we mean by clinical supervision is it's not quite the same as supervision, meaning that you have, a boss who oversees your work. It means that you have the opportunity to meet with a colleague, sometimes someone with more clinical experience regularly, and to discuss tough cases with them to get their feedback and advice. And that can really help with that sense of personal accomplishment at work as well. Sometimes all it takes is just to hear from a supervisor, you handled that really well. I would have done it similarly. Or if it's constructive feedback, here's how we could handle it better next time. At least then the mental health provider feels like they have a safety net and they're not in this all alone. Sometimes our clients' issues can feel so overwhelming that we can feel like we don't have the skill set to approach it. I feel that way a lot as a psychiatrist. And what I've learned over time practicing is that I'm not alone and I'm on a team. And so whenever I'm feeling like I'm not quite sure how to help a client, I go seek clinical supervision or peer-to-peer mentoring from another colleague, and it makes a huge difference. So I just wanted to introduce a few other terms that are, in the literature about burnout and that, can be related to it. So burnout can be associated with compassion fatigue, and we'll talk a little more in detail about that. That relates to the emotional exhaustion piece that I mentioned earlier. Burnout can also be associated with secondary trauma stress, and this is where a provider might start to feel their own symptoms of trauma based on hearing a lot from their clients about trauma. And so the client's trauma starts to impact, the provider's own sense of well-being, or sometimes they might feel angry on a client's behalf or helpless on a client's behalf. And if that becomes a more intense emotion, it can lead to secondary trauma stress. And then I'm sure many of you on the call are familiar with these next two, which are depression and post-traumatic stress disorder, or PTSD. These are on here just to remind all of us that burnout is not the same as a mental health condition, but it can lead to one. So when a provider is feeling burned out and they're having a sense of emotional exhaustion, disempowerment, not feeling fulfilled at work, if those feelings grow, they can lead to a broader sense of low mood and, even manifest as a clinical depression, as a clinically significant depression. And similarly, with secondary trauma stress, mental health providers can, and the literature has shown, that they can start to experience symptoms of PTSD, such as nightmares of things, their clients have described to them, even, hypervigilance, which means, jumping at every little sound, feeling like someone, might harm you. That can happen when a provider has been, repeatedly hearing about experiences where clients have experienced significant trauma. So I just think it's important for all of us to be alert and aware of those possible, results of burnout down the line, because to be able to be effective in our jobs as mental health providers, we have to take care of our own mental health as well, and be willing to get support and get care if we need it. Okay, so I thought I would just go over, some of the signs of compassion fatigue. And so compassion fatigue is something that an individual provider can experience, but that's also true for an overall organization or team. So, if a team has had a number of clients that they've, heard traumatic experiences from, or if there's an overall sense of, role confusion or role conflict within a team, a sense of being overworked and not having supervision or support, all of those things can lead to compassion fatigue. And so a supervisor on a team might start to suspect that's going on if they see some of these signs within the staff they work with. So high absenteeism can be a sign, just meaning that, certain providers are calling out sick more than usual, not coming into work at the rate they used to, seeing increased conflict within teams. And so, noticing that, a group of providers that previously worked well together are now having more conflict or more complaints with one another. Another sign can be that, an individual employee might be having problems with meeting their deadlines or documentation. So that's another sign in a clinical environment, that I've noticed. People may, not get their, if it's like, an electronic record, they might not get their clinic notes done on time or their client therapy notes done on time. That can also be a sign of compassion fatigue. Low staff morale, so, just people, looking and feeling demoralized at their workplace. Reluctance toward change, so, there might be a member of the team that has fresh ideas about how to make things better, and if other folks seem kind of stuck and difficult, and it's difficult for them to envision things could be better in their organization, that's another sign of compassion fatigue as well. And that relates to the lack of vision for the future. So I hope, that this slide just gives you like some signs to look out for within your coworkers, your colleagues, your supervisees, or your supervisors. And then if you notice any of these, it can be worth a sensitive one-on-one conversation with somebody about, if maybe they're struggling with some burnout or compassion fatigue. I just wanted to show everyone a quick self-assessment for burnout. Thank you so much. So this is a freely available questionnaire. We included it in the files you can download if you would like. It's called the Professional Quality of Life Scale. And it has, it's not very long. It just has one page of items. And some of the questions are phrased positively. I'm sorry, like number 22. I'll get the pointer going here. Like number 22, which says, "I believe I can make a difference through my work." Or question 24, "I'm proud of what I can do to help." And then some of the other questions are phrased more negatively. Like, problem-based questions, like number 26, "I feel bogged down by the system." Number 28, "I can't recall important parts of my work with trauma victims." So that is, a symptom of traumatic stress, feeling like, you're not able to remember certain experiences. That's what happens when people have experienced direct trauma as well. They may, have amnesia or lack of memory for certain parts of the experience because the brain just blocks it out due to it being so traumatic. So if that happens to a provider, that is a sign of secondary trauma stress. So what I like about this tool, if we go to the next page, is that it breaks out these three components that I was trying to talk about earlier. So there are subscales that you can add up to see, is there any element of compassion satisfaction or compassion fatigue, right, is the other part of it. But this is the strengths-based part of this questionnaire, so how satisfied is someone with their work. And then burnout is, the flip side of that, which we talked about. And then there is this other part of compassion fatigue, which is secondary trauma stress. So in this tool, they define compassion fatigue as having two elements, burnout and secondary trauma stress. And burnout is a sense of hopelessness and negative feelings about work. And secondary traumatic stress is, basically looking at symptoms of trauma and feeling traumatized by clients' experiences. So if we could please just go back to the PowerPoint, that would be great. So I would just, there are other tools out there as well that I found when I was looking for possible questionnaires or self-assessments people can use for burnout. And so there are other ones too that might be better or feel more appropriate for your individual organization. But what I like about this one is that there's a strengths-based aspect to it, which is that measuring compassion satisfaction, but then also looking at those warning signs of compassion fatigue, which include burnout and secondary trauma stress. Okay, so just want to briefly go over, some actions that people can take to prevent or to reduce burnout so that, if you as an individual notice that you're starting to feel symptoms of burnout, how can you manage that? So I know some of this seems, really obvious, but just want to, point out that we really need to take care of ourselves, and that can help reduce burnout. So for individual providers, practicing self-care, just having something outside of work that helps you to feel renewed and rejuvenated. It could be a hobby, it could be exercise, it could be, regular social outings with people you care about, but just having some kind of self-care. Research has shown that pursuing continuing education can really help to prevent burnout. So, when people learn more about their profession or learn about new techniques or expand their toolkit as far as what tools they use with clients, that can really increase a sense of satisfaction and also efficacy at work. Reaching out to others for support. So, that includes colleagues at work, like looking for people who can be peer mentors, people who can be, your go-to person to discuss a difficult interaction with a client, just to, get some outside feedback. Having that regular interaction, that's helpful, but also reaching out to others for support outside the workplace. And so making sure that you have a network of friends, family, or, your own mental health team to have as, a safety net for talking through difficult times at work. The basics are really important, getting enough sleep, getting exercise and fresh air, having a healthy diet, pursuing your own mental health care. Meditation and mindfulness are also techniques that have been shown to help, as is, spirituality and pursuing that in your own way. Organizations can also take steps to reduce burnout among their employees. And the citation here is to an article about that, which I didn't put in the files, but I can share that afterwards if folks are interested. So some of the steps that an organization or, the leadership of a group can take are increase social support for employees. And that means creating a culture where people feel comfortable going to one another, having social events, having team building events for everyone. So there's a sense of camaraderie. I talked about this one earlier, increasing individual employee autonomy and decision making, so that people feel like there's some aspect of the work they have ownership of and that they can really take leadership over. That can go a long way, regardless of the job title of the employee. And then also just reducing role ambiguity. So talked earlier about role conflict and role clarity being a protective factor. So, having clear job descriptions, reviewing those regularly, reviewing, roles on the team regularly, having an organizational chart people can refer to, and just going over those charts when needed or when confusion comes up. That can be very helpful. Regular supervision, and here what I mean is clinical supervision. So, having that opportunity to, and having protected time so that not every hour of the day is with clients, but actually having protected time and having an organization support that, having leadership support that, to have that 1 hour a week or protected time to just meet with a peer or to meet with a clinical supervisor. And then, we've talked about workloads, making sure those are manageable. And then, it really does help for the organization and leaders within it to promote self-care, because when they do that, it helps create a culture that, it is okay for everyone to devote time to self-care, to take mental health days when they need to, and things like that. And it looks like people are asking me in the chat box to share a bibliography and to make the source for this slide available. Yes, I'd be glad to do that. I can share that with the Institute after this presentation so they can get those materials out. And I'm going to just hand over to my colleague, Adam Vicente, for the rest of the talk, and look forward to the discussion. Thank you.
Thank you so much, Puneet. Again, my name is Adam Vicente, and I work at the National Indian Child Welfare Association as a community development specialist. And my role here is working with tribal communities that are implementing their system of care, basically philosophy, which is aimed towards children's mental health care and building children's mental health systems. And so the experiences that I've had with working with tribes is it has been varied. But I know this has often been, burnout has often been one of the challenges that we've seen, and something that impacts tribal communities and has definitely been seen through losing staff, turnover, instability, toxic environments, and those sort of things here. So I want to talk to that here within the next couple of minutes, but I want to start by really framing the sort of cultural approach when it comes to addressing burnout or helping overcome burnout within tribal communities, and I would probably say indigenous communities, the understanding of the world is very holistic. There's an understanding that everything is interconnected and that relationships with everything around you are very important and are always trying to be basically in balance. And so the National Indian Child Welfare Association created the framework of the relational worldview model. Now this is basically an indigenous approach to understanding life, health, and well-being. These teachings are based on tribal philosophy as well as teachings, such as like the medicine wheel, like the Plains tribal communities. Within my community, which is the Navajo Reservation and the Dene Nation, there's also an understanding that of this holistic type of approach. So when talking or thinking about the relational worldview, it's basically 4 quadrants that break down into the mental, the physical, spiritual, and contextual. And so those personal quadrants are, of course, within everyone. And basically, these quadrants are always in flux, are fluid, and are subject to change. And so when tribal communities or tribal people are thinking about how to overcome something such as burnout, which can be seen as an imbalance, the strategy is essentially to address all of these areas holistically. Being able to engage your mental capacity, which is your thoughts, your emotions, being able to engage your physical aspect, which is things you put into your body, your sleep. Engaging the spiritual piece can be exercised in a lot of different ways, such as prayer, maybe going to church, those sort of things. And then, of course, you have the contextual quadrant, which is the relationships that are outside of you. So the relationships that you have maybe with your coworkers or relationships you have with your boss, but also, the larger world around you. So in thinking about a lot of these cultural strategies, tribal communities and people often take the approach of engaging these areas holistically. Now, within tribal culture, there are a variety of different cultural protective factors, and we've listed some here, but these are all different for each individual tribes. There are some commonalities and some connections and parallels, but know that if you're working with tribal communities or with tribal people, their cultural protective factors may look slightly different from another tribe that you're aware of. So definitely note that. But examples such as prayer are good things, because prayer certainly connects to the mindfulness piece. And prayer happens a lot within our tribal communities, especially within our ceremonies. When a ceremony happens and you're going through that experience, you're also practicing mindfulness, which has an immense amount of benefits and is continuing to be encouraged out there. So that is certainly an example of a strategy to help address this burnout that you're going through. Smudging is a process where you're using herbal elements such as sweetgrass or sage, and you're burning them to be able to bless yourself, but also to maybe clear your space, and clear your space because of maybe the energy that is around there. The smells also really impact your senses. When you smell certain things, obviously it can be a trigger too, and be able to trigger and really produce the satisfying emotions or happy emotions. So it definitely has that type of impact in there. And a lot of communities, maybe start their meetings, maybe start their ceremonies, or maybe start an event by smudging or having everyone smudge. So that's another cultural strategy and a protective factor for some. And again, I would say that maybe not all tribes smudge alike, but there are in different forms. The next bullet point, starting the meetings in a good way. Coming together, whenever there are people that come together, is always a great thing. Always there's a lot of energy that is around, of course, maybe the business table or the meeting table. And so it is often an approach and a custom for a lot of tribes to come when you have that type of gathering or a coming together of people. It's good to always, start in prayer or maybe start in silence and really acknowledge and kind of produce a good space and produce, good energy before you begin, brass tacks, before you begin your meeting, So that's another idea there. But, honestly, there's a variety of cultural strategies out there that I would probably continue talking about for the next couple of hours or so. But what I would recommend is, connecting with the tribal community and asking about some of their cultural practices and their protective factors. But what I think is most important here is really thinking about this holistically. How do you interact or engage your mental, your physical, your spiritual, and the contextual pieces when you're addressing this burnout. And there are a lot of ways to go about this. And so if you're able to have positive relationships or healthy relationships between, all those four quadrants I mentioned, you can produce that balance and be able to basically be healthy. And that's what the tribal approach is about. Now, the National Indian Child Welfare Association also created an organizational level using that relational worldview, meaning that just like a human being, an organization also has certain quadrants or is comprised of different components. And so within an organization, you have an environment, you have infrastructure, you have resources, as well as a mission. When all of those four areas within your organization have positive relationships, are in harmony with one another, are coexisting, are in alignment with one another, that can produce a healthy organization. And so that could also be a way to have a healthy environment where folks are thriving, where folks are happy, and continuing to put in the hard work because they know they're supported in these areas. They know that they have all of their needs met. But of course, once you start breaking these pieces down, you can be able to kind of, again, troubleshoot and assess where you need alignment there. So we do provide trainings in these areas here. And so that's another way to kind of look at your organization and being able to produce health and wellness. Some of the experiences and strategies I want to share next here is really working more with some of the tribal communities that we've been blessed to be working with and be in partnership with. And one of them is the Pasquayaqui tribe, and down near Tucson, Arizona. And so with the Pasquayaqui, they were also going through different periods where staff was unhappy, staff was demonstrating chronic absenteeism, conflict here and there. And so what we did with them was used a trauma-informed care approach. And we basically used the principles and the values of trauma-informed care, such as safety, trust, collaboration, voice, choice, transparency, and we divided up the staff, which is around 50 or so, into around 5 or 6 groups And we went over each and every one of those principles in terms of, like, say, for example, safety, and had probably a dozen questions on safety, such as, is your workplace safe? Is your workplace safe for your folks that you're serving, the community? Basically, ask every sort of question you can around safety. And we did that also for trust. We did that for collaboration. And we also, not only asked that within the staff level, but again, the customer level, the client level. We looked at it also from the policy and procedural level. Are your policies safe? Are your policies collaborative? Do people have voice into what you're creating as a policy? And so that was another way that worked well. And honestly, what we did was really just come together and talk, and come together and build relationships and connections. And that was probably the most powerful thing, was being able to have, say, a bus driver meet with a clinician, or a cooking staff meet with someone who works in technology within the tribal community. And that was really great. And that was really providing the community to come together to get to know one another, and interact and build connections, and really deal with some pretty serious topics here, and at the same time thinking about how do we trauma inform our community to serve our clients, but also to serve us, make sure that our needs are met so that we can continue serving the wider community. So that was just another strategy that they looked at. And I want to stop there because I feel like there's a lot of probably good questions and folks that want to bring up some of their ideas. And so I want to transition into our next slide and have folks be unmuted now and start with this first question of, what challenges has your system of care faced with burnout? And so everyone is unmuted. So if you, we'd love for folks to kind of share with us some of the things that
All
you've
guests
been...
have been unmuted.
And feel free to use the chat box as well. So some of the things that we've mentioned in our presentation, we talked about chronic absenteeism. We talked about, folks maybe having conflict with each other. Have you seen the same types of challenges, or maybe the challenges that you've faced on this topic look a little different?
It is. I've been complaining. I'm stressing already. I've been complaining about this heat all day.
And if folks don't plan on talking or joining in the discussion, if you don't mind muting your phone, thank you.
We'd also appreciate any recommendations folks have, here on the webinar about, any lessons you've learned, or, protective factors you think are working well in your organization to help prevent burnout as well. I think that would certainly be helpful to me to hear, and perhaps to others on the call. Or if anyone has ideas about how NCWA can help you with this issue, we would be glad to hear that too. Okay, so there's some suggestions folks are putting in the chat box. So Jamaica said, we start our meetings with everyone identifying something that went well over the past week. That's a really wonderful strategy, and at NICWA sometimes we use the check-in where we start our meetings with asking how everyone is doing.
Yeah, definitely. Staying strength-based is definitely key in keeping that morale positive and encouragement moving forward. So that the language that we use a lot in these discussions, are very important.
And Lakita mentioned that shortage of staff can make people feel more overworked as well, and that's a very good point. And Adam, I wonder if you could help address Camille's question. She asks, how do you manage when people are differently engaged, when some members of the staff might be highly motivated and others are not? Do you have a sense, Adam, of how you might address that given your experience working with our tribal communities?
Often for folks that may not be engaged in these discussions or not interested, I often give them more opportunities to talk and to express themselves because maybe they might be misunderstanding. There's maybe not a connection that they're making to the material, or just to see where they are. And as opposed to avoiding those individuals, so I think that's one approach that I've taken. That and honestly, it's some side conversations too, where just going up to them and saying, I've noticed that you kind of just stepping a little back, or you haven't participated as much, not shaming them or anything like that, or causing attention, especially if you're in a big group, but having more side conversations and, discussing with them about, them being here and just their experience as well. I think once you start to kind of understand maybe where they're coming from, it might reveal some things that could be helpful in moving forward with that person.
Yeah, we're getting some related comments in the chat box too. Folks are saying that, having that freedom to feel it's safe to talk about how you feel, and having a safe environment within the workplace to feel like, they can not only talk about how they're feeling, but about dynamics within the group. Those are really helpful suggestions. And we also have a question from Elena. How would you say that you all balance accountability and being compassionate with your staff? I guess from my experience, I would say that, we definitely still want to have our high standards of, professional accountability, and having, an organizational chart or job descriptions that we go back to and compare to say, are we fulfilling these items, can be helpful. But it's possible to do that in a supportive way, so that when, someone's job performance is suffering, we can ask them if some of the particular factors we just went over, in this talk could be contributing. We can check in to see if burnout or compassion fatigue could be getting in their way. And sometimes just opening that dialogue can help, rather than approaching, a job performance issue first from, a more like, punitive approach. Checking in first in a supportive approach can sometimes help somebody, see both, that their supervisor is watching and is paying attention to some of the, lapses that might be happening, but also that they care enough to try to help that person to, address any barriers that could be there. I find it helpful to ask questions like, what do you think is getting in the way? Like, let's look at your job description. What do you think is getting in the way? Is there anything I can do as your supervisor to help you? Are there things getting in the way within our organization? Or is there anything individually you need for support? So I think just asking questions in that open, non-judgmental way for me in supervision has been one strategy that's been helpful. There might be others on the call, though, that have had experience with that as well, and we'd welcome your responses to Elena's question too.
Yeah, Puneet, I think one thing I wanted to mention on that topic too is, I've worked with some community members that may not have like the skill set or even know where to start sometimes with projects, and which they kind of put off so long, and that doesn't keep them accountable. So, it might be something where, they're assigned something and they may not fully understand how to go about it, or, feel like they're not supported by it. So I think that could be something also that could contribute. But I saw here, there's a comment too, giving validation is important. Yeah, definitely. And then I think, in regards to like the supervision and being able to provide positive support is, having, sort of that I guess, constructive feedback sandwich where you give something positive to someone, but then you also are offering something that's maybe constructive, and then you're ending again with a positive, in regards to whatever they're doing. So just some ideas.
And then there's a question in the chat box from Melissa. We have an issue where leadership thinks they're being supportive, but there's a punitive approach to self-care, balance, and autonomy. How would you suggest creating a more open discussion with others in the workplace? That is a tough one, because some of our suggestions today were, being offered to leadership. But if your leadership, doesn't have those approaches, how do you address that? One option is to present them with some of the literature and just to say, this is what the evidence shows about preventing burnout and retaining staff. I think most folks in leadership are interested in retaining staff. So sharing some of the articles that will circulate, could be one approach. Another approach can be, to individually talk one-on-one with someone in a position of leadership. Sometimes it can be very difficult to make movement in an organization in meetings where people, don't feel comfortable sharing some thoughts like this. So a one-on-one conversation that's scheduled ahead of time about this might also be one way to go. But for sure, there are, some environments where it's very tough to do that.
Puneet, on that topic there, that's where, having self-care and, balance and autonomy is important to be sort of within the mission, as well as maybe some policies as well. I think that's something that some tribes have gone to great lengths to, in regards to making sure that self-care is built into the organization. It's not just something that we talk about, that we value, but there's a self-care policy, or, the mission is, it's been added where the health and well-being of staff is definitely priority within the organization. So that's where you can continue to embed in this sort of self-care practice, and making sure that, leadership is also understanding that it's a part of the foundation here. It's not just something that is said, and is something that, it goes deeper than that. So that's another idea as well.
So I know we're at almost at the end of our time. Just wanted to also ask folks to stay on after the discussion to fill out the survey that's there from the Institute. Really appreciate all of your time and thoughtful comments. And our contact information is here. So, please feel free to reach out to us if there's anything, that we at NCWA can do to help and support you. Adam, thank you as well.
Thank you, Puneet.